Hello guys. Today my guest is the Dr. Sanjay Srivatsa, the wonderful cardiologist from California. Welcome, Dr. Sanjay.
Thank you. Thank you very much. It's a pleasure to be on your show. I understand you would like me to talk a little bit about
Seniors,
common medical conditions.
Yes.
Well, one of the biggest medical conditions affecting seniors today is called edema. We all experience it at some time in our life, and it's the accumulation of fluid in our lower extremities, our legs.
Yes.
Very common, and it's due to many conditions, but it's worth talking about. One of the big issues that comes up when our leg swells is why. One of the common conditions that can cause it is heart failure, and we worry about that as physicians when we see swelling of the lower extremities. But the truth is there are many, many things that can cause edema, and the commonest of them is in fact venous reflux disease, something we call
What's this about?
venous insufficiency, which you probably know as varicose veins.
Yes.
The problem with calling it varicose veins is that many people have varicose veins and don't know because they can't see it.
These varicose veins which we have inside, and you don't see when I am,
Yes.
I am like, I don't know what it's
Yes.
about.
So we're all familiar with the large blue distended
Yes.
veins on the legs that we call varicose veins. But you have to remember that these veins are only visible because the tissue covering them is thin. And if you have people who have more tissue covering their veins, perhaps some obesity and other conditions, fluid accumulation, that can obscure the veins, but they are very visible to us through ultrasound.
What can we do, especially now when we more time sit in home, we don't have possibility to walk outside, and we have sweating in those legs? What can we do? We take legs up, we have possibility to take another supplements, but what do you recommend, doctor?
So the first thing is to stay active. The way the body pumps fluid out of the legs is no different than if you imagine a boat with a hole in it. Obviously water comes in through the hole, and now we start to bail the water out using a bucket. If we bail enough water out, our boat doesn't sink. It doesn't fill up with fluid.
Do you mean walk, you exercise?
Yes.
But when I have pain, how I exercise?
Well, it's always a challenge, and there are many people laboring with different kinds of pain, whether it's orthopedic pain from their knee joints or nerve pain coming from neuropathy. But on the other hand, we still have to do it. And I would encourage everybody to try to practice some seated exercise, even if they can't get up and actually walk. And that would mean merely flexing and extending the foot up and down, because what that does is engage the calf pump, the calf muscles of the leg.
I have this exercise, and I want doing every day 10 a.m. and I want to invite the seniors in my website, not just seniors, but people after 50, and I have special exercise which help him. Okay, we're doing the exercise. What is next?
Well, exercise either seated or standing, perhaps tiptoe exercises using a support so that we don't lose our balance. Walking outside is wonderful, and for those of you who can do even more vigorous activities such as jogging or athletic activity, that of course is also very good. The second thing is to avoid excess accumulation of salt in water. We're all encouraged to drink water, but there are limits. For example, excessive consumption of salt, and you know that salt is in almost everything we eat. Not just Chinese food or soy sauce, but pickled foods, canned foods, various processed foods, and above all, junk food. So limit the salt. Try to use the kind of brands of salt that has less sodium. Sodium is the bad player here.
Okay.
So Himalayan salt is one, kosher salt is another. And then try to not only keep that salt content down, but keep your water content down. Your physician can guide you as to what is a good amount, but in general, 1.5 to 2 liters a day should suffice, providing we're not dehydrated from the sun. So that's another option. The last thing is to use perhaps some materials that can support our legs, support our veins, prevent the exudation of fluid out of the veins into the tissues, and that would be stockings. But these stockings need to have a certain strength, and they need to be measured appropriately so that the stockings that we use are of exactly the right size to prevent the edema.
We're talking about seniors, we're just talking about people after 50, people who is flexibility and walk.
No,
but what kind of reason you propose for people who have invalid in home and people who stay in the wheelchair or staying there.
Everything we've said applies to everybody, and
Water.
particularly so for anybody who is immobile, perhaps due to a handicap, and who is seated in a chair. It's not to say that we can't do the same things for them. It will require different kind of solution. It will require them to perhaps do seated exercise, leg elevation, and we can come up with different kinds of exercises for those people. So the principles apply to everyone. How we apply them to special situations will vary.
What about stockings?
Stockings are key. As I mentioned earlier, I really do think that anybody who has a predisposition to edema should consider them seriously. There are very few conditions in which you could not use a stocking, or perhaps have to use a stocking of a lower compression. That would be a condition in which you have arterial disease in the legs where there is inadequate flow. But for most people, 10 to 20 could easily be tolerated. Speaking of 10 to 20 millimeters mercury strength. 20 to 30 is what I generally recommend to most people, and I recommend not knee-high stockings. Wherever possible, I recommend thigh-high stockings or pantyhose. For one thing, they tend to stay up longer, and for a second thing, they offer more universal compression of the leg, more universal extended support, which is much more beneficial. Like most things, it takes a while to get used to. We all remember having our first braces. Inconvenient, awkward, but after a while we got used to them and they corrected our teeth, so we have to regard things in the same way.
What we want to do when we have problem with heart now is too many stress when we stay in home too much and we are close little bit. And what about heart? Many people thinking the pain in the chest here.
Yes.
It's probably. What can we do when we have this symptom?
First, don't panic. Not all pain in the chest is due to your heart giving you a heart attack. If, for example, you have a pain in the chest that worsens when you breathe in, that's called pleurisy. That's maybe due to an entirely different cause. For example, inflammation of the lining of the lungs, sometimes lining of the sac of the heart. But most pleurisy occurs in the context of some bacterial or viral infection of the lungs. It's indicative of a problem. It isn't a heart attack, and it can be treated with anti-inflammatories. Pain that suddenly comes and goes and flashes for a few seconds, that's hardly likely
we need to call
to be the heart.
Doctor and visit doctor when we feel
A pain that persists, gets your attention, won't go away, causes you to have difficulty breathing, causes you to feel dizzy, your heart racing, or any other untoward reaction which any person with common sense would identify as being potentially life-threatening, yes, of course, you should seek medical assistance. But pain that just flits and comes and goes, I would observe it carefully and just see how things go. You don't always have to panic about that.
But better than we call to the doctor in clinic and we ask what's happening.
If it persists, always seek medical advice, yes.
Okay. Thank you, doctor, for this short interview. And welcome next time. Will be a pleasure to talking with you.
My pleasure.
Especially then you are the famous cardiologist here.
Well, I'm not sure I'm famous, but I'm willing to help any way I can.
For me, always. Thank you, and take care, and thank you so much for your job, and thank you for all your nurses, all your staff in your clinic.
Yes, I'm sure they'll appreciate that. Thank you very much.